Hey, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. I wanted to show you this case. This is Paige. She just finished her Invisalign treatment. I think that this case illustrates a lot about what Invisalign is and what Invisalign is not. And so let me just give you a quick introduction to Paige and her mouth, and then we'll show you about Invisalign, and we'll talk about why the doctor that you choose for your Invisalign treatment matters. So this is Paige, and she came to us with fairly well-aligned lower teeth. Fairly well aligned upper teeth, although one of her front teeth is kind of crooked, and then one of her lateral incisors kind of sticks out, if you see that right here. We were also treating her because she has kind of a big overbite. Now that overbite is hidden because some of her front teeth are kind of tucked back. And she also has what's called a deep bite, where the upper front teeth overlap one another excessively. And this is a situation that can lead to premature wear. So I just want to show you where she finished up. You can see with regards to that deep bite, we can see a lot more of the lower front teeth. So we corrected that. You can see if you look at the side of her bite, this is how teeth should fit together. Perfectly zigzagging like this with no overbite. And you can see perfectly aligned upper teeth and perfectly aligned lower teeth. But I really want to show you how we treated this with Invisalign, and this deep bite situation here is a situation that some clinicians will not choose to treat with Invisalign, or they don't want to treat it. They don't believe Invisalign can fix this. But I believe that with the right doctor and with the right treatment plan and the right mechanics, that this can be fixed, and you've already seen the results of that. So this over here on the left side is where Paige started. You can see that deep bite where the front teeth overlap excessively here. You can see her bite relationship in the back where the teeth are kind of stacked one right on top of one another instead of zigzagging like I showed you how she finished up. And you can see that tooth that kind of sticks out up here. So let's talk a little bit about Invisalign and how that works. First of all, these pink things that you see on the screen are called attachments. They're things that augment the tooth movement, because Invisalign is clear plastic trays, and sometimes the teeth need a little handle so that the plastic can grab onto it and move it the way that it's supposed to be moved. And so that's one of the really important things. I also like to describe Invisalign as like a par 3 golf hole. Now, I hate golf personally, but the way that it often works is that we come up with one plan, we roll through that plan, we do a second little plan, and then a third little plan, and that gets us to a beautiful, perfect finish. That's exactly what happened here for Paige. We finished her up in 18 months, but it took us 3 little sets of trays. So if I can just show you a little bit about what's going on over here on the right side of the screen. These are all the different kind of versions of a plan that I went through. And I'm not going to bore you with all the details of the things that I changed, but in my very first iteration of the plan, I went through kind of 4 rough drafts. I changed 33 different things in the treatment plan. So I customized this for each individual person based on their treatment goals and our treatment objectives. Now when I got to my second set of trays, I did a couple iterations of that plan, and I changed things 29 different times. And then I had my little third set of trays, and I did 2 iterations of that plan, making 17 specific changes to the teeth and to the plan. So that's how we get to a perfect result, is that we do this kind of in segments, one set of trays, then a second set of trays, and then often a third set of trays to really make it perfect. Like I said, lots of customization that goes on depending on the specific treatment needs and the treatment goals, and that's all done by me, the doctor. So Invisalign is not a very smart program in terms of actually moving teeth. It requires lots and lots of customization for the doctor, and that's why the doctor that you choose for your Invisalign plan matters. Hope you enjoyed that little explanation of Invisalign, and if you have any questions, please give us a call. I'm happy to answer those questions.